I want to introduce our two speakers here today, who I think all of you have at least some familiarity with, but just in case. Philip Kim, who was candidate for state senate in this district last year. And then our real rock star here, Audrey Denney, who was candidate for the 1st Congressional District. And I hear rumors might be again. I don't know about that. But we don't know that for sure, of course. But we hear suspicions of that.
I heard those too. I don't know. I cannot confirm nor deny.
You have to be a special glutton for punishment to do it more than once, I think. We do know that resistance obviously is going to be a massive. How do we overcome that? What's some of the kind of work that will help us to overcome that kind of resistance?
So when David asked me to come hang out with you folks today, I thought, what can I bring to them? What can I show up at the table with that would help them in their mission? Because you folks know as much about the benefits and the why behind what we're fighting for as I do. My thoughts around this are really how we can advocate for it. And that, I think, gets to David's question, which is how do we combat the resistance? And we combat this resistance from these powerful groups with so much human political will that it cannot be denied, right? And we've seen that growing and growing and growing. But still, in the 11 counties that you folks represent, a lot of times when you go out there and you start talking about Medicare for all, or you start talking about single payer, you hear things like, it's a government takeover of healthcare, right? Raise your hand if you've heard that. Everybody. It's gonna bankrupt our entire country. Raise your hand if you've heard that. And then I want you to think really seriously for a second about what you say when people say that. The one thing that I know for sure about changing people's behaviors and mindsets is that facts, coming to them with facts, that doesn't change behavior and mindset, right? And so what we do to change behavior and mindset, how we create this political will, is by either giving people experiences and then guiding them through reflections, or by doing that with a story and then asking them questions, right? People's minds are changed about things when they're talking, not when they're listening. I'm gonna keep talking. So a couple of the tidbits that I wanted to share with you on how we actually do that. There's 3 things I want you to remember. When we're talking about this super, super important issue, we've got to tailor our message to our audience, right? So any educators in the room, I see you already nodding your head, right? The first thing we think about is, who is this person that I'm talking to and what do they need to hear, right? And the second thing I want you to think about is that there is not a more personal issue than healthcare for people, right? This deeply touches everyone on a personal, visceral level. Everyone has had a healthcare experience from themselves or their loved one that makes this so, so personal, and you just gotta tap into that. And then the third thing is that instead of trying to get really specific in the really nitty-gritty, you've gotta find those places of shared common values, right? We have to keep this on the high moral ground of what we're fighting for, right? And what we're fighting for is making sure everyone has health coverage, right? It's on the list behind me, right? That it is truly affordable, that it's comprehensive, that everything is covered, and that there's justice in it, right? That it's the same for everyone. And so those are a couple of the things that I knew I wanted to get out, so I thought I'd just share on my first question everything that I had prepared to tell you. So, recapping, tips for advocating, right? Tailoring it to our audience, making it personal to you so it's personal to them, and then finding those shared common values that you have and that they have. And then I'm gonna give it to Philip to talk about his ideas for combating the resistance.
In the next couple weeks, Representative Pramila Jayapal from Seattle, Washington, is going to be introducing a new and updated Medicare for All Act of 2019. A lot of the focus on the federal fight is on this House bill. We have a majority in the House, and we have a real path to advancing and passing Medicare for All in the House. We need to put pressure on all of Congress, but we're especially putting focus on 24 members all across the country who are members of those 2 committees, who are Democrats who did not co-sponsor the previous HR 676. And in California, we have 4 of those members. There's Nancy Pelosi as the Speaker of the House. She's one of the focuses. Scott Peters in San Diego, Tony Cardenas in the San Fernando Valley, and one more who's Raul Ruiz in eastern Riverside County. So I'll say more about what the plans are with the field plan, but we have a really exciting campaign and we have the chance to really move this along. And in the context of the coming 2020 presidential election, and with California probably being the most important state in the primary now because of the earlier primary, we have an opportunity to really elevate this issue even more. And it's already been elevated by Bernie last time in the 2016 campaign. Medicare for All has never been more popular. 70% of people, all the polls are showing, 70% of the American public supports Medicare for All, and people are realizing that this current broken, fragmented system, this profit-driven system is failing way too many people who can't get the care that they need. So what we have to do is we have to translate that support into grassroots pressure on our members of Congress. So please call your representative.